Hi everyone, my name is Jessica Harnish and I'm the nurse manager of Occupational Health at Whitman-Walker Health, a community health center with multiple locations in Washington, D.C. We would like to share some information with you today about how to effectively wear a mask. The mask could be cloth, disposable, might have a face shield attached to it. They are all good for their own purposes and all help prevent COVID-19. Wearing a mask in public and in high traffic areas like grocery stores and pharmacies, it's what we need to do right now to prevent COVID-19. When we do wear these, they help prevent spreading respiratory droplets from coughing, talking, singing, or sneezing. Before wearing a mask of any type, you want to practice good hand hygiene. So you can do that at a sink with soap and water, or you can do it with hand sanitizer. So I happen to have hand sanitizer right here. It's more convenient a lot of times, and it's been shown to be at least, if not more effective than washing with soap and water. So I have a bottle of hand sanitizer here. Most are meant to give you enough hand sanitizer in your hand to effectively rub your hands together for 20 seconds at least to clean your hands. So I'm gonna do one full pump of this. As you can see, it's a good bit of hand sanitizer. I'm gonna start rubbing my palms together. In order to clean under my nails, I'm going to scratch each palm, and that helps clean under my nails. We also want you to do the backs of your hands, as well as around your thumbs and in between your fingers. Really, you should have enough hand sanitizer to go over these areas multiple times. We want to use the hand sanitizer until it's completely dry. It's more effective to continue rubbing your hands together and going over them than it is to wave your hands to try to dry them. And so my hands now are dry, they're no longer sticky or wet from the hand sanitizer. So next we're going to go ahead and put on a disposable face mask. The ones that I have here are called procedure masks. And since I've used hand sanitizer, it's okay to reach in and touch the outside of the mask. So the outside is usually colored. The inside that goes against your face is usually white. And the top side usually has a piece of flexible metal inside of it. And then the bottom that goes around your chin does not have metal. Most of the time you want to hold the face mask by the elastic stretch ear loops. And so I'm going to go ahead and place the mask on my face. I won't be talking while I have the face covering on. Okay, so I was trying to show that you want the face mask to be snug enough around your face that air isn't escaping easily along your chin, your cheeks, or your nose. You do want to practice hand hygiene before you put the mask on, before you take the mask off, and after you've removed and discarded the mask. If you must reuse a mask, I would recommend placing it colored side down onto a clean surface. And then when you pick it back up, do so by the ear loops. Don't touch the inside or the outside of the mask. And place it back on your face. And then apply gloves and wipe down the surface where the mask was sitting. You want to make sure that the mask covers your mouth, nose, and chin. And then if you are going to wear glasses, or goggles or a face shield, you would want to go ahead and put that on after applying the face mask, after you have the face mask on your face. You want to avoid touching your face and mask. COVID-19 spreads through droplets and can get in through your eyes, nose, and mouth. So that's why we want to try to protect those areas. Some other face masks that I have that I want to show you. This is a face mask with an eye shield attached to it. This one still has ear loops. And so what I recommend doing with this kind of mask is to fold it completely in half and crease the eye protection shield. This helps form it around your face better when you go to put it on. So this way, instead of it being flat, it's already angled. So again, what I was saying is just instead of the face mask starting off flat, it's already angled, which is a little bit closer to our face shapes. Cloth face coverings come in many shapes and sizes. My favorite style is the one or the kind that has kind of a nose part sewn into it. I am not a seamstress, so I was lucky enough to have a friend who could send this to me. I recommend putting your chin in first, and then your nose, and then around your ears. And then again, take it off by the ear loops. Placing that one down. Have another one similar. It has the nose piece kind of sewn into it. This one only has one strap to tie. I've thought about putting Velcro on it. I'm not sure how that would work just yet. So that gives you an idea of a few. If you do have a face mask with ties, strings that tie instead of the ear loops, I recommend tying it at the top of your head first. You want it to be not too tight, but tied firmly onto the top of your head. And then the other one can be a little bit looser around your neck. And then I want to go over some of the don'ts, some of the do nots for wearing a face mask. Don't use one that is ripped or damp. You don't want to wear the mask only over your mouth or your nose. Both need to be covered in order to be effective. And so, for instance, don't wear the mask like that. We really need to cover both your mouth and your nose. We don't want you covering your neck like that. If you're going to take it off and not throw it off, away right away, then again, put it on a clean surface. And after you put it back onto your face, wipe that surface down. You don't want people to hang it over their ear. All these other ways, you know, they're spreading more germs than they're preventing, and so that's why we don't like that. Somebody told me that they saw somebody wearing it on their forehead. This feels silly. I can't imagine wearing it like this. But again, mouth, nose not covered, and if anything, you're spreading germs to your forehead, which can then get into your eyes, nose, or mouth. Try not to touch your mask or adjust your mask while you're wearing it. That's why it's important that once you have it on your face, you adjust it so that it fits well and is not going to move around on you. And we don't want to remove the mask in order to talk to somebody. I know that it provides a bit of an extra barrier in trying to communicate with others. We can't sort of read lips along with hearing them, and then it's harder to hear, but really try to keep yourself from removing the mask before you're done with your activities. I recommend, if you're going out, for instance, into the neighborhood to run essential errands, to keep the mask on your face the entire time. I don't think it makes a lot of sense to remove it for riding in the car for 5 minutes just to place it back on your face. I think it presents more opportunities for germs. So we hope that you learned a lot about healthy mask use and care. Just a few more tips about COVID-19 prevention. Remember that a mask is not the only thing that's going to help you. You also need to be practicing good hand hygiene, which we talked about a little bit here. Medical providers need to wear gloves when appropriate. And we want to maintain that 6 feet of social distancing. If you're with somebody who you live with, the 6 feet of social distancing is less important. It's not easy to do that in a studio apartment, for instance. But around strangers, you definitely want to keep at least 6 foot distance. Children under 2 years of age or anybody who has difficulty breathing normally should not wear a mask. And for people who are not in the medical community, recommend not wearing an N95 mask. We do want to try to save those for people who are working directly in closed proximity with a patient with COVID-19 symptoms. Although we understand that some people already owned a mask and they used it for painting or something. So we understand that some people in our community will still be wearing those masks, and that's okay. If you're experiencing any symptoms related to COVID-19, please call our Whitman-Walker team at 202-745-7000 for a phone consultation and a possible appointment to get tested for COVID-19 at our Northwest or Southeast locations. Thank you for watching, listening, learning, and for helping us to prevent new cases of COVID-19.